Welcome. Let's talk about identification of different type of fever and medicinal treatments. Fever is a temporary increase in body temperature often due to an illness. It is generally considered as a sign of the body is fighting an infection such as virus or bacteria. The infections like viral, bacterial, inflammatory conditions like rheumatoid arthritis, certain medications like antibiotics, vaccines may lead to fever. Normal body temperature typically ranges from about 97 Fahrenheit to 99 Fahrenheit. It is in Celsius 36.5 degrees Celsius to 37.5 degrees Celsius. Fever is usually defined as the body temperature above 100.4 Fahrenheit or 38 degrees Celsius. Body temperature is controlled by hypothalamus. Conversion of Fahrenheit to Celsius. Fahrenheit equal to 9 bar 5 into Celsius plus 32. Rectal temperature are generally 0.4 degrees Celsius higher than oral temperature. Fever can be symptoms of various disease and conditions like viral infections, influenza, COVID-19, common cold, dengue fever. Bacterial infections like pneumonia, urinary tract infections, bacterial meningitis, tuberculosis. Parasitic infections like malaria, leptospirosis, Chagas disease, fungal infections like histoplasmosis, candidiasis, heat-related illness like heat exhaustion and yeast stroke. Inflammatory and autoimmune disease also cause fever, rheumatoid arthritis, systemic lupus erythematosus, inflammatory bowel disease, vasculitis, and certain cancers, lymphoma, leukemia, solid tumors, and endocrine disorders also cause fever like hyperthyroidism, adrenal crisis. Other conditions like drug induced fever like antibiotics, post surgery or post trauma fever, thromboembolic disease. Next one, symptoms of fever. Common symptoms include chills, sweating, headache, muscle ache, loss of appetite, and dehydration. It is typically come with sign of infection or illness. Hyperthermia. Hyperthermia is a condition characterized by an elevated body temperature. It is an uncontrolled increase in body temperature due to the body inability to dissipate heat effectively or external factor. It differs from fever. It is not regulated response and can lead to the heat related illness. Fever is regulated by hypothalamus. It can lead to serious complications like heat exhaustion or heat stroke, which are life-threatening conditions requiring immediate medical attention. Hyperthermia caused by excessive heat exposure, strenuous exercise in hot condition and dehydration, certain drugs or medical conditions. In case of fever, regulated increase in body temperature typically caused by body immune response to infection or illness. It is physiological response to help fight off pathogens. Symptoms of hyperthermia. Symptoms can include hot, dry skin, especially in heat stroke, confusion, rapid heartbeat, nausea, and in severe conditions. Loss of consciousness may also occur. Next one, hyperpyrexia. It is an extremely high fever, usually defined as a body temperature exceeding 106 Fahrenheit or 41.1 degrees Celsius. It is considered a medical emergency and may indicate serious underlying condition. Severe infection like meningitis, heat-related illness like heat stroke, certain drugs, stimulants, certain nervous system disorder like stroke. Hyperpyrexia require immediate medical attention. Rapid cooling measures like a ice pack, cool bath may be necessary. Treating the underlying cause is critical to prevent complication. Symptoms of hyperpyrexia: confusion, altered mental status, seizure, and possibly loss of consciousness. It can lead to serious complications such as organ failure if not treated promptly. Fever patterns: continuous fever. The temperature remains elevated above normal throughout the day and does not fluctuate more than 1 degree Fahrenheit or 0.5 degree Celsius if you don't use any antipyretic medication. Causes of continuous fever often associated with infections such as typhoid or pneumonia, COVID, dengue, viral fevers as well as certain inflammatory disease. Remittent fever. The temperature remains elevated but fluctuates throughout the day with the temperature dropping but never returning to the normal. Fluctuates more than 1 degree Fahrenheit or 0.5 degree Celsius. Causes remittent fever typically associated with infection like endocarditis or abscesses. Intermittent fever. Fever episodes are present for several hours followed by periods of normal temperature. The temperature can fluctuate significantly, fluctuate more than 1 degree Fahrenheit or 0.5 degree Celsius. Causes of intermittent fever commonly seen in conditions like bacterial infection. Relapsing fever, characterized by recurrent episodes of fever with periods of normal temperature lasting several days in between. Causes of relapsing fever often caused by infections such as malaria, typhoid, Borrelia, Hodgkin disease. Hodgkin disease is a cyclic like 3 to 10 days fever and 3 to 10 days no fever. Next one, how is the body temperature regulated? The body temperature is regulated through the process called thermoregulation, which involves several systems and mechanisms. Hypothalamus. It located in the brain acts as a body's thermostat. It monitors body temperature through the receptors that detect changes in temperature within the body and environment. Thermoreceptors. Peripheral thermoreceptors located in the skin. These receptors sense external temperature changes. Central thermoreceptors located in the hypothalamus and other internal organs. These detect the body internal temperature. Next one, response mechanism to temperature. When the hypothalamus detects temperature change, it initiates a response to maintain balance by increase body temperature and decrease body temperature. To increase body temperature, vasoconstriction. Blood vessels in the skin constrict, reducing blood flow to the surface and conserving heat. Shivering. Muscle contract involuntarily to generate heat through the increased metabolic activity. Hormone regulation. Hormones like thyroid hormones can increase metabolic rate, producing more heat. To decrease body temperature, vasodilation. Blood vessels expand, increasing blood flow to the skin, allowing more heat to escape. Sweating. Sweat gland produce sweat which evaporate and cools the skin. Next one, behavioral changes. The body may prompt you to seek cooler environment or remove layer of clothing. Next one, symptoms of different type of fevers and treatments. Dengue fever. It is caused by flavivirus. High grade fever for 2 to 7 days with headache, severe muscle and joint pain. It is also known as breakbone fever. Rash that may appear several days after fever onset. Several abdominal pain and bleeding may occur. Lab diagnosis. NS1 dengue card test positive within 5 days. IgM, IgG, ELISA are positive in 5 days. Progressive decrease in platelet and WBC. Tourniquet test positive also. Next one, treatments of dengue fever. IV fluids, blood transfusion, paracetamol 500 mg tablet IV or oral 3 to 4 times per day. Next one, common cold or influenza. Sudden onset of high fever, runny nose or congestion, body aches and fatigue. Respiratory symptoms including cough and sore throat, throat pain in cases of viral pharyngitis and tonsillitis. Treatments of common cold, combination of paracetamol and antihistamine. Tablet like Sinarest or Vicodil 3 times for 3 days. Influenza treated with antiviral drugs oseltamivir 2 times per day for 5 days. Next one, chikungunya. Unique feature of chikungunya is the intense and debilitating joint pain, which can last for weeks or even months after the initial infection. Associated with high fever, rash and muscle pain, fever with headache, chills, joint pain, vomiting, nausea, also its symptoms. Lab test, chikungunya IgM ELISA positive. Treatments of chikungunya, rest and fluid intake, NSAIDs for pain and fever, paracetamol used for the pain and fever, chloroquine phosphate 200 mg once daily. Rickettsiosis. It is a bacterial infection. Symptoms like fever, headache, myalgia, lymph node enlargements. Lab diagnosis, IgM ELISA positive, scrub positive, hepatic transaminase elevated, leukocytosis. Treatments, doxycycline used for the treatments of rickettsia. Leptospirosis or rat fever. Contacted with infected animal or indirect contacted with water or soil with rat urine. Flu-like illness, Wales syndromes, jaundice, renal failure, hemorrhage, myocarditis, and other symptoms like meningitis, pulmonary hemorrhage, respiratory failure. Lab diagnosis, Leptospira card test positive, IgM ELISA positive, hepatic enzyme CKR increased. Treatments, doxycycline 100 mg orally 2 times for. You can use ceftriaxone 1 gram IV once daily. Typhoid fever, gradually increasing fever, abdominal pain, headache, weakness, loss of appetites and sometimes rashes. Duration 5 to 7 days. Diarrhea or constipation may occur. Next one, malarial fever, cyclic fever, high fever followed by chills and sweating, and headache, muscle pain, fatigue, and sometimes nausea and vomiting. Rheumatic fever, fever, joint pain, fatigue, and some cases rashes or heart related symptoms. Sepsis, high fever, rapid heartbeat, confusion, difficulty breathing, and other sign of organ dysfunction. Next one, treatments of fever. Over-counter medications, acetaminophen. Acetaminophen means paracetamol, reduces fever and alleviate discomfort. Next one, ibuprofen. It contains ibuprofen medication in Advil, Motrin, Brufen. So many brands are available. It also reduces fever and can relieve the pain. Suitable for adult and older children. Common approaches for managing fever: increased fluid intake, drinking water or clear broths and electrolyte solution helps to prevent dehydration, especially if fever is accompanied by sweating, vomiting, or diarrhea. Get plenty of rest. Allowing the body to rest helps the immune system fight off infections. Cool compresses. Apply cool cloths. Placing a cool, damp cloth on the forehead or taking lukewarm bath can help to reduce fever and provide comfort. Light clothing. Dress lightly. Wearing lightweight clothing and using lightweight bedding can help to keep the body cool. When to seek the medical attention: high fever above 103 Fahrenheit or 39.4 degrees Celsius. Fever lasting more than 3 days. Several symptoms such as difficulty breathing, chest pain, severe headache, confusion, or rash. In infants under 3 months, any fever should be evaluated immediately. Thank you for watching.